Good evening, TCM Talks. Nice to have you here. Thank you, Nicholas, Zhigang, Tianjun, and Ni. Good evening. So imagine we have this scenario. Someone suffered from migraine for years, and he visits doctors from one doctor to another one, and just get a different prescription after prescription after another prescription. So after a certain period, he built up his small home pharmacy, get all of prescribed medications or over-counts, but still he didn't find the help a lot for his migraine. So one day he may find out, okay, someone suggests to make appointment with one of these therapists is not really recognized as a mainstream medication therapist, and to start put some needles on his head or feet or somewhere other part of the body. And or he starts to drink some very bitter Chinese coffee, we call it herbal medicine. And he realized, okay, after a few weeks, it sounds like a start work. So we are going to discuss tonight, so the difference or the future of our medicine with traditional medicine or modern medicines. So what do you think it's going to be developed further in the future of our society, whether the modern medicine will take over the traditional medicine, or they will be in the state of coexistence?
Okay, well, I can say that I think that with the way it is now, I definitely see a segregation between traditional medicine and Western medicine, and a big segregation, and also at the same time small areas where people start working together. Doctors on both sides of the world start working together, and that's very nice. So I do have some perspectives on where to go with that, but I think there's definitely two sides, and I think people need more information on the possibilities of traditional medicine.
But since we are all practice traditional medicine or Chinese medicine, acupuncture, etc., so Li, do you think there will be one day, probably not in our age, after 20, 30, or 40 years, this traditional medicine, including acupuncture or Chinese medicine, will disappear? Since if we look at the modern medicine developed so quick.
Yes, I would not say in our lifetime, traditional Chinese medicine will disappear. But definitely, I don't see the real hope will be practically Chinese medicine will become part of Western medical system. We will still stay in the between the medicine or life care or post-medical Western modern medicine, post-medical care or preventive, this field. Because there is a problem I noticed is recently, last many years, I remember from our Luxembourg Congress, has been more than 10 years, and the societies call on for evidence-based medicine. I think everybody knows this. But if really they put Chinese medicine to be proved in this box, which means we know what the end will be. In the end, Chinese medicine will be not scientifically proved. So this could be a bigger tribe, which means they put us to this. This is dangerous. So everybody knows.
You don't think in the foreseeable future, like in 5 decades, traditional medicine, for example, Chinese medicine, will not be integrated in the Western society with modern medicine?
No. If we integrate it, we will not call it Chinese medicine anymore. At least don't call it classical Chinese medicine. You will call it modified traditional Chinese medicine, and partly is meet the Western medical or scientific technology medicine, the same standard.
Okay. Zhigang, do you agree with what Li just said?
I think Chinese medicine in modern society has a lot of roles to play, and especially in the West, it is called alternative medicine, because Chinese medicine approach from different perspectives, especially holistic view, how to treat patient, not only the disease itself, but also recover his energy balance, like yin and yang. That's the key point, I think.
Okay, Tianjun, we were talking about whether we can be the traditional medicine can be integrated in the Western medicine, in the Western the mainstream medicines. Li just mentioning one thing is about proof, about the evidence. So traditional medicine in most of the Western countries is not considered as scientific. So how do you think about that point?
Okay, this is a very commonly argument point. Whatever which country, in the most of Western countries, this is often argument point for you. But the question interesting, in the Western doctors' point of view, this is not a question. They did not argument with us. But most time we argument with them, or we argument with public societies. So we try to prove we are science. We try to prove we are evidence-based. But this is also a question from the modern society. This is our job. So how to we say integrate, or how to translate our the traditional medicine, or most we say Chinese medicine, to the modern society. This is a job. This is we say a challenge for us. As just now you mentioned, in the maybe in the next 5 decades, in some countries, in some aspect, maybe we say as a Chinese medicine, as a society, or as we say as subjects, maybe we also not say completely disappear, but maybe majorly disappear. Such
a better way, you think?
Yeah, put away. But the practitioners are still there, but not. This is not we mentioned the Chinese medicine, traditional Chinese medicine practiced by Chinese doctors.
That's interesting, Tianjun. You were mentioning it's not really the Western medicine practitioners want to argue about that. It's on the other way. We want to prove, we want to argue, or actually we want to defend ourselves, right?
Yes.
So talk about the difference of traditional medicine and modern medicine. Many people say that without modern medicine, thousands of lives, even more will die every year. We will not reach such a big populations on Earth. But on the other hand, people think traditional medicine will improve the quality of life, even maybe practically. So to dealing with especially the emergency urgent cases, serious cases, like the replacements of certain internal organs, etc., or maybe Western medicine or modern medicine has its advantage. So, Nicholas, you are a European practitioner, so it's different from 4 of us. I mean, we are trained in China, so Chinese medicine, in a way, it's already in our blood. So, from your perspective, how do you see the difference between what we call Chinese medicine, and the mainstream medicine here in Europe, which is called Western medicine?
Well, I think there's I think that the general I mean, I see it as the medicine that has shown me a path with my career and my medicine, and I'm also trained Western medical, but I think that the one of the problems is that it's been coming from like you say, an alternative medicine, and then it became a complementary medicine, and now that the Western world is using the word integrative medicine, and I think, like Lee said also, that this will be a problem integrating these two medicines because they're so totally different systems, and like you discussed before, like the research part of it, like if you want to be acknowledged as a serious medicine, you will have to do research and scientific research, and that there's a problem in the research. I mean, I've done some research of Chinese medicine, and the way it's set up is made for pharmaceutical industry and not for Chinese medicine, because it doesn't have that special personal look on each person as an individual. So I think there's some challenges in the way of looking at the two medicines that will be very difficult to integrate, and I think that being trained in both worlds and being a Westerner growing up here with Western medicine as the primary and then turning to Chinese medicine has just opened some doors that I never thought were possible to open. So I've been working a whole lifetime until now to tell and to show health professionals, doctors and nurses and midwives and so on, about the possibilities of Chinese medicine, trying to educate them in Chinese medicine. And I see that there's such a difference, because everything is boxed in Western medicine. It's everything. Our way of thinking is very linear. We look at a problem, we see a solution. We don't look at the problem and then we see everything that comes and gives the problem. So we're just looking to find the solution, and if the solution is there, well, then you maintain a certain health. You don't get sick until next time. So I think there's a lot of it's just so different that it's very hard to integrate. And when you do it in Western hospitals, it will be on the terms of Western medicine. It will not be on the terms of Chinese medicine. And therefore, like Li Ji said also, this will be a problem for Chinese medicine, because it will be like, you have to cut off essential parts of the Chinese medicine to make it fit into the system of Western medicine. But
okay, actually, this is also a dilemma. So we want to be integrated on one hand. On the other hand, it feels like the box cannot just fit two different things. One is in square, another one is in round. So same things when we talk about evidence-based EBM. So it feels like it's very difficult just let traditional medicine, Chinese medicine, acupuncture to fit for this kind of protocol of modern medicine, like scientific research. I think Ni have more opinion on that part, right?
Yeah, I has been all the time. Yeah, you know me, Weixiang and Nicholas. We have been discussed scientific day in Rodenburg many years. I think we need first remember, medicine is not patented by Western technology, scientific technology, also not patented by Western society. Medicine has been exist during evolution of human being. So now we have an idea, if it does not meet the standard of Western medicine, it's not medicine. So that's the number one problem. Number two, this is totally two, like Nicholas said, it's totally two different systems. So why not we can remain one medicine, two system. You know, traditional Asian medical system, because totally we acknowledge it, that's totally another system. And technology, modern medicine is another system. So we take one medicine, two system, together work. I think it's not difficult. Inside deeply is, I think, is a culture and mentality discrimination. I call them cultural discrimination, which means it's not my understanding system. So I have been research all these evidence-based medicine. Many of them is really cannot say anything even according to scientific method. For example, 2016, England has been did so much basic, so-called evidence-based medicine. They find the conclusion is acupuncture does not help low back pain. They even made a document, but I look at those doctors, those professors, none of them understand any Chinese medicine acupuncture. So those people started to evidence basic medicine. From beginning, the logical is wrong. So I totally against. We need to find how to we both stay in the one medicine but the two system.
But actually, do you mean, if I understand correctly, you think evidence, both of traditional medicine and modern medicine, based on evidence, but on different way of the science.
Right.
So we cannot use the way of conventional medicine, Western medicine here, to evaluate traditional medicine, right?
Evidence, yes.
But actually, there is another saying. They talk about traditional medicine and modern medicine. They think actually it is a paradox. There is no traditional medicine. There is no modern medicine. Only one medicine, as long as it works. So Tianjun, you were mentioning, you think maybe after decades, traditional medicine the term will gradually fade away, but maybe the spirit will be integrated in the Western medicine society. That's what you want to say, right?
Yeah, first of all, I will say I follow the Ni's opinion. I will partly disagree with you. And if only we completely keep our two necks, we always on something like the train railway go parallel to two lines. I will say TCM or Chinese medicine will be disappear soon. Because on the left hand side, we say the mainstream medicine, modern medicine, they are getting more stronger and stronger. If the traditional medicine not care of the modern medicine, what do you do? We just do myself. I don't care what you think. Then I will say we are getting more smaller and smaller because our areas are getting much less. In the last several decades, if we only do our traditional way, our subjects, our basket, we are getting smaller and smaller. I would say we will find some areas are our advantage, but disadvantage from the modern science. But this advantage we need to prove we can do something advanced than mainstream medicine. But how to prove us? This is we call the evidence. We need to show to the modern society we are advanced on this area. So I would say we should keep our core philosophy, but on the other hand, we should use modern language to translate our philosophy and our methods to the modern society. Not only keep the real part of the.
So Tianjun, you're trying to say that if we want to prevent from a gradually diminishing of this traditional medicine or Chinese medicine, we need to find the proper way to communicate, to have a proper dialogue with modern medicine. Otherwise, probably the future was not as good as we hoped. So,
Yeah.
Zhigang, what is your opinion of this one?
Yes, just like Weixiang earlier mentioned, the migrant patient, if it is treated in Chinese medicine, this patient will first identified into different patterns, whether it is excess type or deficient type, whether it's yin type or yang type. But I have seen one review how this acupuncture investigation, clinically investigation has been done. The view of the article say that patient being treated with acupuncture often has a much different quality and quantity. What I mean here is the patient often being treated once a week and 10 weekends. And the intensity of the needle stimulation often is just reached 0.3. But averagely in China, most of patients, they are stimulated by needles at level of 0.8. So that's nearly 3 times higher. And also acupuncture is treated every other day, sometimes even every day, 10 times a course. So this is a totally different approach, and in terms of the frequency, in terms of the intensity. And also the qualified acupuncturist in the West, they are, in our view, is not able to make correct pattern identification. So if the pattern exists, you identify it as deficiency, the result will be totally different.
You mean some of them, at least except Nicholas, right?
Yes.
So Nicholas, so we were talking about maybe the Chinese medicine way and Western medicine way is based on the different theory, the fundamental theory. Actually, there are one group of scholars of TCM believe the biggest challenge is a way of thinking. And we think Chinese people can practice Chinese medicine better than those people who don't have Chinese medicine, Chinese culture background. So because the way of thinking is different. So, but I don't believe that's correct, because if I see you, right, you run very successful school and practice there in Denmark. So share with us, please. How do you think about this kind of point of view? So do you need to be really like a Chinese people to think in Chinese way?
Well, no, because I disagree with that, and I think that the people we see in the West are Westerners, and I think to promote a medicine and our practice as acupuncturist or herbalist or whatever we are, I think it's important that we speak the language of the people around us. So if we come from a different culture, we have a difficulty relating to patients. And I get referred a lot of patients from Chinese professors around Denmark because the patients complain that they cannot communicate with the professors or the doctors that they see, which is a problem because we in the West, like we were discussing in the last time, we were discussing the psychological challenges. And people in the West, they like to talk. That's what we do. I mean, we have the Freudian background. We like to discuss our emotions and our feelings. So I think one of the really important thing is when a patient comes into the clinic is being able to listen to what they're actually saying and taking them seriously. And I think that has a cultural challenge. If I were to move to China, and that would be a challenge for me as well, because I wouldn't be understanding the culture the way that I understand Danish or American or European culture. So I think that's that I think that it's important to assimilate to the place that we live. And I also believe that the whole thing of integrating two medicines is on the level of education is a very important thing. And I think the level of education needs to increase. And I think there's also a very important aspect of this is that there needs to be more openness. There needs to be more willing to share information. So to share information on how you treat and what you treat, and being public about it, and not going around and holding it into yourself, but sharing. I think that's really important to open up to the public.
Absolutely.
And I agree with
Absolutely.
that, because the communication is for sure very important. So at least from my side, I'm able to communicate with patient in Dutch, in English, or in Chinese, whatever.
And here, the communicator, I'd like to say, not only language, but also the terminology. Some people, they can speak a good English, but they couldn't explain what's your mind, what's the treatment plan to the patient. The patient still couldn't understand what's the main the purpose they are here. And also, we need carefully to use our TCM or traditional medicine terminology for the modern society people. Such as I got a sample case. A colleague told me a story. She gave the patient a diagnosis, she got a purpose training. Then finally, she told the patient, okay, your problem is a kidney deficiency. Oh, for TCM, yes, very great. Then she used acupuncture medicine to treat the patient. Then next session, the patient called her. So please cancel all my appointment for next session. I need to go to my doctor to see because you told me I have my kidney problem. She went to the doctor to have the totally kidney assessments, all the blood tests, all the scan, etc. Finally, the doctor said, you have nothing. You have no kidney, have no problem. But the TCM doctor said, I have kidney deficiency. So this also should be carefully to use. We living in the Western country. We are took with the patient. They got the science education. But if we believe that the pure TCM terminology, that we are not only make the patient understand, even some confused some problems. So that's the communication, including the language and the terminology.
Yes, that's of course this kind of story you can repeat it again and again and again. So we heard many times.
Yes.
So I totally agree with Nicholas just mentioning. So the communication with the patients, and Tianjun said it's not only the communication with the language, but be careful to use the terminology, of TCM. And what's the success from Nicholas or the other people like Machochia, Peter Tederman, etc. in Europe, in America, and many other countries worldwide, and it proves like you don't need to be a Chinese original, and you can still to become a very, very good TCM practitioners. So I want to back to your question, Li, about scientific study. So I think in the modern medicines, when we talk about scientific research, they use RCT. It's a randomized controlled trial. So this is something I think how at least they believe we should communicate with them. So we were just talking about communication. I think this is another level of communication. So what is your point of view of RCT?
My point of view, the method is not right. Now I come back to Tianjun and Dr. Yang and all the time, including Nicholas, your expression. The communication, Chinese medicine, this moment, you are talking about the folk medicine, the medicine for the patient. From patient, will upgrade to the medical system. From medical organization, will up to the government. This is totally different than Western medicine. Western medicine is from government to the medical system and to the people. So this is the Western society, is a government, is a country, any country government machine. Medicine is a government, part of government machine. So what we need to do is we use this, like Weixiang Wang said, this research randomly, the patient randomly, but the method, evaluation method, statistic, this method does not fit, is not suitable for research Chinese medicine. Just like Dr. Yang said, Chinese medicine, you have so many complex factors, and then Western statistic, this evidence medicine, they need to fix the certain standard, certain protocol. That's not Chinese medicine anymore. Like Dr. Yang said, you need the needling, how deep in the acupuncture point. But the Chinese medicine is according to this person, what constitution, how big the person, what kind of 5 constitution. Then you depend on how deep you needling. Each people are different. So this.
Lee, you agree actually for traditional medicine or Chinese medicine, we need to have a randomized control trial.
That's okay.
But in different criteria to evaluate it, right?
Right. You need every individual. So this only, I see the future. Is in the future that the computer technology become big data analyze, which means every individual keep individual, and we put all the random group, no matter every is individual, we can calculate them as one, as a totally group. This method is traditional statistic, is kill Chinese medicine. Really, many times I look at all the article, published statistics, the trial, in the medical way is fabricated. It's not maybe not a special do for that, but in the end, the result is fabricated because its method does not work for Chinese medicine. So we need to take care. Besides this, I also want to see, we need also, don't forget, traditional Chinese medicine is remained developed by Chinese, but not only belong to Chinese, belong to human being. We need to preserve this human knowledge, this treasure. This we also have to remind, not only look forward, we have to preserve our knowledge. It's our spirit of human being as knowledge, right? So this is what I'm the one, you know that I'm very strong against evidence-based medicine research for acupuncture, but for acupuncture, Chinese herbal medicine even cannot talk about. It's a terrible research. So I speak this in China also. Stop the evidence-based medicine, do research for Chinese medicine this moment. Waiting.
So actually, let's make it clear. If I understood you correctly, actually you're not against scientific study.
Right, I'm not.
You're against, you think we need to have a different independent criteria system for
methodology.
Acupuncture or Chinese medicine research, right?
Right methodology for right research.
Great. So, Nicolas, your response.
Do you agree, Nicolas?
I think there is a tendency for, that's what I see in around evidence-based medicine and acupuncture. I see that there is a tendency to have a more pragmatic approach and a more individual approach. So that gives the possibility of the practitioner or the doctor who treats to make individual diagnosis to each patient that they treat, even if it's for asthma or whatever. That it's within the parameter of the research that they're able to do it individually. This, of course, sets aside the double-blinded research, which is the golden standard research of Western medicine, and that this cannot be integrated in Chinese medicine. I just don't see as possible. It makes it only into protocols treatment, and that's I don't think that works in research very well. The research I did personally was on facial diagnosis, and it was on recognizing signs of emotional imbalances in the face. And I also set the standard of individual diagnosis, because I couldn't put it into a form that would work if I didn't do that. So, and it was accepted by the university, and I think we see a tendency that Chinese medicine could be researched in that direction, but it's very difficult. It has very many challenges. I see it.
But actually, in the conventional medicine, Western medicine society, they understand that, they know it. Not everything they are working based on evidence, right? I think according to the database of WHO a few years ago, I was invited by a forum in Luxembourg, and like about 1/3 of the medication or the treatments of conventional medicine based on evidence, actually. So another 1/3, they are not so sure. Another 1/3 is just a totally gray area. But still, we think,
right.
as Tianjun just said, that we try to prove ourselves, we try to defend ourselves. So we need to, I think, no matter you're working, living in China, in the Asian countries, or in the Western society, but we have to recognize this, the fact that Western medicine is in mainstream, is in dominant position. So how, in your opinion, Tianjun and Zhigang, we can find a way to prove ourselves, to show it works?
I think acupuncture or Chinese medicine, including acupuncture, herbal medicine, and other exercise, it won't disappear because this healing process has been proved more than 1,000 years. That's the first place. Second place, the patient will choose which healing method is more efficient in the long term, not only in the short term. And for example, more than 10 years ago, in a Dutch statistic research institute, they published on the newspaper about the acupuncture healing power. How many people will choose regular medicine? How many people will choose also acupuncture or herbal medicine or other traditional medicine? And they found out the result is that higher educated people will first choose acupuncture for the long term. And people have to work, and they choose regular medicine because they want symptoms to be relieved immediately so that they can still go on work. And I think Chinese medicine is going parallel with the Western medicine, especially the way of approach, the way of thinking of Chinese medicine should keep go on and should not be changed in that way. So that way I would agree with Li Jie.
Tianjun, your comments.
Okay, yeah, I would say basically I agree with Zhigang and Li Jie. Yes, sure, we need to keep our core the points, our core philosophy. That's no doubt. But on the other hand, we also communicate. We need to we say or whatever we say prove or communicate with the modern society, the mainstream. From many points of view, say from one point of view, if we only keep ourselves, we have a good business, my clinic are very busy, I have good, enough patients, that's fine. Of course, there's something like a focal doctor as a clinic, that's no any problem. But as a society, as our subject, we need some of us, we need to do something more than just a practitioner in our private clinic. We need to communicate with modern society in a current way. How do we prove our what we say the evidence based or science or efficacy, etc., to get more the mainstream the exception for us, such as insurance, such as we involved for some of the condition treatment, such as the moment, as we all know, because the coronavirus, we are out of the mainstream. No any country, except China, no any country accept Chinese medicine or the whatever TCM or whatever the home medicine Chinese acupuncture as partly as their mainstream treatment. We can only do a little bit in our private clinic, which is, I believe in most countries, less than 1% of their patient, of their the cost come for of this. Why? They said you have no evidence. In the UK, at the beginning, particularly when the Prime Minister suffering from coronavirus, the infection, lots of our practitioners try to contribute to help him. Lots of society or personally, they write letter to the Prime Minister, the Downing Street number 10, and also times the hospital. We say, oh, we can contribute, we can treat them. China, we have the national guidance, but they all either ignore or they said you have no evidence. So that is a sample, as in this case. But also I would say, as a subject, as a professional, as a profession, we need to do something, communicate with them, use their language. Because we try to communicate with them, we should use their language to communicate.
Okay, actually, Tianjun also said that it's, you can choose, for example, geographically, you can choose, you just stay in isolated small islands, enjoy your nice beach, sunny weather, very clean air, blue sky, or you want to join part of the continent, right? So actually, so this kind of a situation is pretty hard to decide. I mean, not depend on us, but at least, as Tianjun said, some of us or the generation, we need to think about that. How do we want a traditional medicine or Chinese medicine develop further in the Western society, or we just want let the TCM as a small island to keep the original way and not really integrated with Western medicine's idea. So how do you think about that? So this is actually related to the topic of evolution of traditional medicine, whether we should stay as an original way or we need to adapt to the modern clinics.
But Weixiang, I just remind things. Why not we look from another angle to look at the Western society? Actually, the Western society they know Chinese medicine has strong evidence, like Zhigang said, 1,000 years. This is why, as a system, the government system, they allow Chinese medicine exists even as a job. We are doing this. So why not look at that? Which means government people, I don't think those people, they are not intelligent, they are stupid. They are also professional, educated. They know what is science, real, but they also know where is the miscommunicate. I think we, from this point of view, to see, we also could be take a relaxed way to do our best individual, to do our best job well, to help the patient, let the patient give a good voice. It's a democracy, Europe. The people will respond to say Chinese medicine good, and slowly the government will see how to manage it. I think they know Chinese medicine has strong evidence. It's one of very good medicine, but they don't know when, how to take in yet. Behind that, there's also economy related, right? Not, and the culture and the management. So I think why not think that way?
Tianjun, I saw you're moving your neck. So your remarks.
I disagree with this point.
Why?
From my point of view, I have lots of contact with Western society doctors and some policy maker, etc. They did agree. They don't believe we have science-based. We have no any evidence or not enough evidence to prove.
So the question is, Tianjun, I ask you one question. You mentioned these people, do they know Chinese medicine? This is a big problem. They don't know at all Chinese medicine. They deny the Chinese medicine. I call them, these people, is arrogance, stupid. This you can't call stupid, it means arrogant, you denied something you don't know. This is not logical. I saw so many of them. I give you a good example. Professor Han Jisheng. Everybody know, if you, particularly you, do the brain research. I studied with him in Beijing University for many years. So he never say, when he come to lecture, he said, don't tell anybody I'm an acupuncturist. I'm a physiologist. This hand stimulator, electric, I don't call it acupuncture machine. It's a stimulator. It's a neurostimulator. It's not acupuncture. So which means those English, those doctors, they deny the Chinese medicine. I look at all of them. I even read an article of them. None of them deeply, thoroughly study Chinese medicine. Then they start stand up to deny the Chinese medicine, no evidence. This is discrimination, scientific discrimination, cultural discrimination. They are not really honest. It's political behind.
Sorry, Ni. I don't think there are dishonesty, but actually, I think they are not well informed. Because, for example, we talk about Chinese medicine or acupuncture in our society, because all of us practice for decades. So we think every people should know that, but actually, probably the truth is, the fact is different, right? So that's related to another topic, is how do we inform the publicity, including the lawmakers, about Chinese medicine, about the traditional medicine, which make it possible for the further development of legislation in Western countries. So, Nicholas, do you have this kind of experiences to have make contact with the Danish government or the health authorities to discuss or argue about the legislation about traditional medicine there?
Yeah, there is a political ongoing argument, and the problem is, of course, that traditional medicines are a drop in the sea, and there's not a lot of political influence behind it, and there's not a lot of power, we as practitioners of traditional medicines, we're up against a massive economic power from the pharmaceutical industry, who influence the political power and who are controlling the media's view on traditional medicine. So this industry is not particularly interested in integrating Chinese medicine or traditional medicine into government-funded treatment protocols. So I believe that the change has to come from the public, and we do not have Chinese medicine or traditional medicine in our blood in the West. We have Western medicine in our blood, and therefore it has to come from how we teach our kids. And the way we teach our kids is that we are influenced by people around us, and especially by the media. And to change the media, we need to get more information out on the possibilities of traditional medicine, and that because the only place it can change from is from the people, and because it's the people's medicine, and it is documented that more and more people in Western countries turn to acupuncture and other treatment possibilities, alternative treatment possibilities, because they see that they work in a different way. And I think this is the key to integrate more Chinese medicine, is through the general public. And I think that's the way to go.
Great. Actually, Nicholas, we see if we, I think Ni also know that if you look at a few years ago, what happened in Switzerland. So because there are a big demands for just the people, Swiss people think we need to have alternatives. We need to have acupuncture or the other complementary medicine. So at the end, they had, maybe you heard of that, it's a couple of years ago, they had a national referendum. People just vote. So from then on, the traditional medicines, including Chinese medicine, acupuncture, in the national healthcare system there. So which is, I think about what Nicholas just said that, so we need to do something to increase the publicity of traditional medicine, to even start to educate our kids, our patients. And the change must come from the people, from our patients. So I think in many European countries, we started with like a week for acupuncture, week for TCM, etc. Dr. Yang, your association, and we are also a few years ago joined with Zhigang. We together started with week for acupuncture. So what is your point of view on this kind of publicity? How do you see the importance?
I think whatever country in the Western world, they need to organize for the traditional medicine. This moment, at least in Holland, the government does not give any management to the so-called alternative medicine. And in my view, it is better that all the different professional associations, they united together, and they can publish a guideline for patients, how to choose a different healing method for their problems. For example, I have quite often a patient after antibiotic treatment. The first symptom is fatigue, long-term fatigue. Second, recurrent inflammation. Keep coming back, the inflammation. For example, like cystitis, bladder infections, or other infections. So when their body resistance, we call the 正气, are weak, so they get these problems again and again, sometimes even 4 or 5 times a year, being treated with antibiotics. So I told them, what most important, for example, the cystitis, when they feel burning feeling, they take herbs, what I gave them immediately, and at a regular time, they treat also with acupuncture. So in that way, they can prevent that happen. This is just like a quote from classic Chinese medical book. It says, the intelligent healer will treat potential disorders. Or let's say the better doctor will treat preclinical disorders. Just the beginning of that disease happened. Often it's functional problems. So the patient should not wait. In that moment, if they wait, they landed across the borderline. So they have to be treated again with antibiotics. So how they can get informed? And this is very important. That's also our task, how to tell the public more different choices. That's my view.
Thank you. If you're, we have to turn to another topic. Actually, if you look at this, the development of Western medicine, we call the modern medicine, since 1970s, the death rate from heart disease dropped nearly 60%, and the deaths from stroke are down 70%. And also we can see the deaths of cancer drops to 26%, and HIV/AIDS patients, its survival rate is more than 75%. And in only like American people's lifespan already increased totally different from 60 years ago. Now in 2017 reached averagely 80 years old. So publicly there are a lot of information proof this is a contribution or most of the contribution come from the modern medicine. But obviously, we know there is a contribution also from traditional medicine, from Chinese medicine, from acupuncture. Okay, let's talk about another issues here. So in your guys' opinion, what is our strong point? What is our advantages as practitioners of traditional Chinese medicines? So obviously we cannot contribute to the surgery of the heart disease, of the stroke, of the AIDS, HIV, positive, etc., of cancer, but we can contribute to be part of that or the post-cancer therapy. So I would like to have your say. What do you think our strong points as traditional medicine practitioners?
Weixiang, I follow this question. I want to say that we keep this in mind, what you just mentioned, this data. We use scientific way, use their way, but use separated system to decide, like Zhigang said, parallels way. If hypothesis like that, basic on what you that data, we plus Chinese medicine, traditional Chinese medicine to prevent heart disease, to prevent cancer, to take care after operation, after Western medicine treatment, this data, they should show how much increase. Then that's called fair. Easily, it's very logical.
Great, very good point from Li. So actually he was emphasized the importance of prevention. So if they could do this kind of prevention properly without this surgical treatment, also the situation will be helped, right?
After treatment, prevent death will be also increased. But then nobody do this research.
Okay, Tianjun, what is your remarks? Okay. What do you think our strengths?
Yeah, here are 2 points. First of all, I totally agree with Li about the prevention. This is one of our TCM advantages. But of course, we need to do something to prove involve the TCM prevention. We can massively reduce the death rate, etc. This further, I agree, but we need proof. Secondly, I will say the one of the advantage of TCM, I always we say teach my students and also communicate with my patients. We say the advantage for TCM for Chinese doctor compared to the Western, the modern society, it's the holistic. That means we took your whole system as a one picture. you come to see me maybe several different symptoms, several different problems, but majorly you are you. You are the problem is all on you, based on your personality, etc. So I would say this is one of our, at least is one of the advantages compared to the Western medicine, modern science society.
Nicholas.
I have to concur about the preventive medicine. I totally agree, and I also agree with you. I think that that one of our biggest advantages is that we have a holistic approach, and we actually treat the person and not the disease. That we treat the cause and not the symptoms. I think that's a core difference.
Zhigang.
Yes, even in China, some big hospitals, they even denied TCM students. They just finished their study. And they found out that TCM treatment is too cheap. So the big hospital, they have to get enough profit. If they treat it with acupuncture or herbal medicine, it's not enough for them to get income. So they prefer a patient to go through all these very expensive investigations, like MRI photos. So that's why Chinese medicine has a strong point. They can stand on the ground. For the long term, we have to pay attention to, first, holistic approach. Second, do more things for prevention of disease happen. Just like I said, a superior healer or intelligent healer will treat potential diseases or preclinical diseases.
Great.
And I give a smaller follow Dr. Yang said. And for Chinese medicine, in the traditional Chinese medicine, we have a term we call it 坏病, which means a doctor, you treated disease A, you mistreated the patient developed disease B. This is a responsibility for doctor. Doctor should not do that. But in that perspective, you can look Western medicine, every medicine have a side effect. Many strong side effect actually is enormous, according to Chinese term, is 坏病. It's you make a new disease. So this part also can compensate by Chinese medicine. How do you guys think? I think that is also can.
You agree, Tianjun?
Yes, of course. I generally speaking, I agree with it. I would say this is one of the advantage for traditional Chinese medicine.
Okay, great. So we know today's Sunday. This coming Thursday will be the new Chinese year. So this is the year of ox. According to the theory of 5 elements, this will be the year of metal elements, right? So we think it's a year of changing. And of course, we are looking forward to have many changes, because we cannot stay further like the year 2020. Before we end up this program, I would like to invite each of you to have a final saying about your clear point of view on traditional medicine and modern medicine. We start from Nicholas this time.
Okay. Well, I think, like I said before, there needs to be a higher level of education, a higher academic level of traditional medicines for their acceptance and for their integration. And I think there needs to be a better information to the general public about the seriousness and the possibilities and the advantages of traditional medicines, and that they also treat very serious diseases. And I think this will lead the way to more political influence. And I think this is the key to opening the minds of people of political power, and thereby also to more openness and and willingness of the national health services to accept and integrate traditional medicines.
Thank you. Zhigang?
I think, in summary, I agree with you. The traditional medicine and Western medicine both has a strong point. That's advantages and disadvantages. So both can be integrated, but in the long run, it should be in a parallel way. Thank you.
So we keep each other's identification.
Yes.
Thank you. Tianjun?
The summary point, I will say, for the developing of traditional medicine in the Western society, we need positively communicate, properly communicate with modern society.
Great. Li.
I would like to summarize. There should not, how to see, what we see. There's two systems. We have a Western modern technology medical system. We have a natural traditional medical system. So two branches each belong to one medicine. We call it human medicine. There's no West or East. Human medicine likely have two systems. They need to unify together. They need to help each other. They need to learn each other. The goal is in the end to benefit human life.
Thank you. I think it's for traditional medicine, especially practice traditional medicine in the Western society, we need to make it clear, at least by the practitioners like us. So what is the strength of traditional medicine? What is a weakness? What is our opportunity? And what may threatening the traditional medicine? So this is not only come from 5 of us. We need to have more people participate for this debating and contribute their opinions. Only by this way, we gain more and more point of view for how to develop the traditional medicine or acupuncture, Chinese medicine in the Western society, in the modern society. Though we totally understand that, personally, I don't believe traditional medicine will ever disappear. But I do agree, all of you just said that way, in the future, there will be no traditional medicine, no Chinese medicine, no Western medicine. There will be only one medicine. This is, as Li said, humans medicines. So I thank you very much for this nice dialogue and communication tonight. So in advance, I wish all of you a happy new Chinese year. Thank you.
Happy New Year.
Happy New Year.
New Year.